Well, I guess Europe won't be able to spend more on healthcare since the U.S. is already forcing them to spend more on defense.
Right.
So what I see is that if we look in the U.S. and we talk about healthcare reform, there's a lot of people that push the idea that we can't do anything like what you see in Europe or Canada or other parts of the rich world because look, you have waiting lists, you don't have good service, a lot of things that occur. The first thing to note is that the actual health of the population is not better in the U.S. It's worse in the U.S. than most of these other countries. Now, there could be some demographic and cultural reasons for that, but as far as the healthcare system goes, we are paying more. In many cases, twice as much. It's 20% of the gross domestic product in the U.S. compared to about 10% in other places. We're paying much more, and we're not. Still, people don't necessarily have access. There's challenges, et cetera, within the U.S. So we have to, look in the mirror and realize that. Now, when you look to Europe, you could say, well, you mentioned these statistics about waiting times and so on. Guess what? You at least have the accountability. So they'll have statistics and they'll say the waiting time has grown from X to Y. You can actually analyze that in the NHS data. You can't find that in the US. Try looking and seeing what are waiting times somewhere, and you'll find an academic journal article that somebody wrote a few years ago that talks about trying to get a dermatologist appointment in Boston. So you've got accountability in Europe. I would say, yeah, I mean, one way to actually look at this is potentially to spend some more money, even within the existing context of the existing system, and see how far that gets you. But there's no panacea for healthcare. There's no easy solution, which makes it good for experts and good for investment.
I'm just wondering because this is really happening now after this COVID period. So obviously there must be like a direct kind of causational effect that's like caused because COVID, nobody could get treatment. Now everyone is back in the hospitals and back at the doctors and so on and so forth. So like how does this play into it exactly, and why don't you see this like in as much in the US as in Europe?
So I think what happens with, if you think about being in healthcare, it's been more than just a job or even a profession. Being a physician, at least in the US, has been more like a priesthood. It's
Right.
something you do, and when you ask somebody, it's not like, what do you do for a living? It's like, what are you? You are a doctor. And so that means that, and historically, that's come at the expense of family time. It's come at the expense of whatever. You're a physician and you treat people. Now, what's happened in recent years, and this is generally the case, I can't comment so much in Europe, is that now it's just like another job. A physician is just another professional. And by the way, there's a lot of people that are doing a physician role, like a nurse practitioner, physician assistant. The general term provider has been there. And during COVID, what happened is the physicians and other healthcare practitioners were risking their lives, and some, in fact, died. A good number of them did, from COVID. And instead of having just the complete appreciation for it, there's even resentment or conspiracy theories. And the
Right.
worst, and at least there is just these like, gee, this is a tough trade-off, and the job is unrelenting. And when people leave it, it actually makes it worse for those that are remaining. So I think it's as in many industries, it's given people to kind of have a chance to take a look and say, gee, did that make sense? Where I was almost literally, in some cases, killing myself in order to be in this profession. So then what happens is you start to have the challenges that you have in any kind of a process. Like what I learned in business school is whenever there's a factory process, there's going to be a bottleneck somewhere. And if you remove the bottleneck, then it's going to reappear somewhere else. And it's hard to balance the system out. So the system has come out of balance, partly because of all the demand from COVID. But then if you look what occurs on the supply side, and you've got these gaps, you have staffing issues. So where we see this right now in the US and Massachusetts, where I am, is the hospitals, when they want to discharge a patient, the skilled nursing facilities don't have room for them because they don't have staff. So if they don't have staff, then they can't get the patient out of the hospital. If you can't get the patient out of the hospital, then you can't treat the new patient that's coming in. And so that way may mean that, for example, an ambulance, which also has trouble staffing, instead of being on the street, the ambulance is sitting there at the bay of the emergency room waiting to let that patient in, and they're not out on the streets. And the people who went to become ambulance drivers or emergency medical technicians or paramedics, they didn't sign up. They signed up for the action. They didn't sign up to sit there waiting at a hospital. So the whole thing comes out of balance. I think that's one thing that's occurred. And in the US, it's also been coupled with a pushback on immigration. And so one of the ways that we have dealt in the past with expanding need is through new supply through immigration. Now, I know in Europe, there's been quite a bit of immigration. There's also a backlash against it there as well. And
I
you'd
think
also have a very low...
the doctors moving out, though. I think the net migration
Yeah.
of medical professionals is quite negative
Yes.
Apart from maybe Switzerland.
And then you have also a very low birth rate. Right. So if you're going to have a low birth rate and people getting older and needing more healthcare, there's going to be an imbalance in healthcare and in other industries too, but healthcare is particularly notable.